Damian Anderson is from Salem, Utah, and he graduated from Brigham Young University in 1999. He taught high school for 3 years before starting dental school. He's married, has a 14-month-old son, Hayden, so he's pretty busy. But he did find time to prepare his remarks for today. He says his goal is to help people work with his hands and be his own boss. And these goals led him to pursue his career in dentistry. He enjoys golf and cable TV. But most important to him are his family and his optimistic view of life. Please welcome Damian Anderson.
The thought of speaking here is very nerve-wracking, I have to admit. As nervous as you get preparing a speech like this, the reality of it all didn't really hit me until last night. My wife came up to me, she had that look in her eye, and she said, "Before you give that speech tomorrow, I'm going to wax your eyebrows." I think that's my early thinking. The only other time she's insisted on taming my wild brow was 7 years ago when we were getting our engagement pictures taken. So I knew this is going to be a very big deal. So I'd like to start off, of course, by thanking my classmates for thinking of me when they were asked to select someone who epitomizes the topic I'm here to talk about today, professionalism and service. It's an honor. I think they also expect me to slip a joke in, so hopefully I can think of the perfect place to put in a joke that can span the generations present here today. Something involving the Olsen twins, 8-track tapes, and the cotton gin. So you know that. I'm going to divide my talk into 2 different topics, and I'm going to talk about service first and then professionalism. For me, it's a little easier if I can divide it up. The importance of service brings to mind a quote. Dr. Damian, of course, took all the good quotes. So I'm left with this quote by Helen Keller. She said, "The unselfish effort to bring cheer to others will be the beginning of a happier life for ourselves." And hopefully everyone here can relate to the great feelings that you experience when you're able to give something, money, service, or a puppy, to someone who really needs it. Over the next 2 years, we'll have many opportunities to serve the public. We are encouraged, of course, to take advantage of the opportunities afforded us, and kindly reminded that we won't graduate if we don't do it. I hope that we will approach these opportunities with a positive attitude and develop a habit of finding time to give something back to the communities we live in when we leave. On a more serious note, I remember when I was applying to dental school, I felt like I was really behind the 8 ball. I was 26 years old, and as I went to my interviews, I noticed that most people graduating were 26 years old. I didn't feel like my college performance was average even. And my aspirations to become a dentist were based on 2 counts of hearsay. These didn't come up in any of my dental school interviews. As far as anybody knows, it's I want to work with my hands and serve people. It's all very dear to me. The 2 counts of hearsay. First of all, my wife, she went to the dentist, a new dentist in town. And she came home and she was talking about her new dentist and how much she loved him. She said, he is a really funny guy. You're a funny guy, you should be a dentist. For some reason, it seemed to make sense at the time. The other thing that led me a little bit to this profession was, the thought of having a 3-day weekend every week and a couple of days time. I thought that would be something that I would enjoy. So anyway, my wife comes home from her cleaning, or as we dental professionals are encouraged to call Dr. Brown's out here, and I could get in trouble. I believe we're supposed to call it an adult prophylactic anti-plaque procedure, ADA billing code 87006F. Very technical. And it kind of made me start thinking, maybe this is something that I would like. So to make up for my poor undergraduate performance and a late start, I went to our dentist and I said, I'd like to start following around and kind of see how I like this. He was happy to oblige, helped me pad my then naked resume, and we became pretty good friends. Not so good that he'd let me use his name in my speech, but I feel like we're pretty good friends. As I was spending time in his office and golfing with him on Fridays, he would tell me, as my interview taken through here, he's like, you need an angle. He would keep saying this, even when I'm shadowing, you need an angle. You know, in order to get into dental school, you're going to need an angle. You know, I had he involuntarily winced, you know, like when I told him I undergraduate GPA, and I had to take maybe 8 hours of dental office shadowing experience, and, you know, I'm kind of low on the angles. So one day, you know, we're out golfing, and he was asking all these questions, and I, you know, I was lacking all the go-to angles. I had no emotional attachment to dentistry, no inspirational relative was in the field. I never even received an emergency dental procedure that had altered my life path. What can I say? I was really a high school teacher desperate to improve my faith. So, it must have been about the 16th hole, you know, we were talking, and he got into a discussion about some of the things I was involved with in my community and with my church. And he startled me abruptly, you know, all of a sudden he just says, service, that's going to be your angle. And, you know, I thought he was kind of scraping bottom, but, you know, I went with it. After all, I like to see people happy, you know, I think, you know, if there's something I can do to cheer somebody up, I'd like to think that I would do it. So I applied, and to make a long story short, I was fortunate enough to get into the University of Florida. Since arriving, I've noticed that service is not just the bottom of the barrel angle I had assumed it to be. I found that in dentistry, the spirit of service and the attitude of wanting to help others is paramount to success. I'm sure it will make our careers more fulfilling and our lives more enriched if we seek out opportunities to help those in our future communities, either through our skills as dentists or as influential members in the community. Now I'd like to switch my focus to professionalism, and as Dr. Damian explained earlier, the two are very intertwined, and so they go together really well. And up until now, our professionalism has been evaluated by our behavior during lectures. If it's not too traumatic, class of 2006, I would like you to reflect in your mind about those long and tedious days back in C14. From what I hear, it was just lecture after lecture. Everything from embryology to physiology, from amalgam trichology to intensive lectures on bacteria with names like actinobacillus. I wrote it down. Actinobacillus actinomycetium capnophagate contact. Ring a bell. We call it AA. Big name for such a little guy. Now our professions will be measured by a different standard. It will be measured through the eyes of our patients, how they perceive us, and our interpersonal skills as we communicate with them about the care they are to receive. Having an undying passion for clinical dentistry myself, I have put in what seems like thousands of hours observing upperclassmen work on their patients, and I would like to share with my classmates some of the insight that has led me over the year. I will start off with these three things, and when you have mastered them, I will give you more. Number one, communicate with your patients. I'm sure some of you have experienced both sides at this point in your observations. Some patients have complete confidence in their student dentist. They have an open dialogue with the patient, feeling free to ask the questions to their student doctor, and the student answering and asking follow-up questions that will help them to understand and discover the concern. On the other hand, I've also noticed that some student dentists are totally preoccupied with thoughts of perhaps what competencies can be met, or concerns of inadequacy. Even as a patient asks them a question, you can see in their eyes that they're thinking something else. They're thinking, perhaps, I wonder if I'm going to stab this guy in the lip when I give him a shot of lidocaine. Like Dr. Damian was telling us. No, that's probably a one-time thing, and that probably happening again. But I do wonder, I noticed he has some crowding up here in his anterior teeth. I wonder if when I put that rubber dam on, I'm going to bruise his jaw. I think, that's probably a one-time thing too. You can kind of see that they're kind of preoccupied, reminding themselves of failure rates of different alveolar, the inferior alveolar blocks, different things like that. But the patient's going to notice that too. So, it's important that we listen to them and give them our undivided attention. Something that works well is when they say something to repeat it back almost like they said it, because, it helps them and it validates them, and you will understand when you do it that they will have more trust for you. That's what happens when I try to get serious. Anyway. But where I am this thing and I'll get back on track. You probably heard that communication is 90% listening, and so it's very important that we validate their concerns, show them you're paying attention, and listen to things that they say. Also, it's very important that we explain things to them in words that we recognize. And if anyone out here writes questions for the microbiology section of National Forestry Part 1, you need to listen to that advice too. I remember one of my patients, whose name and social security number I can't reveal to you because of HIPAA. She told me actually in our treatment planning session that the reason she came to the school and left her private practice, her private dentist, is because she didn't feel like he was listening to her and she didn't trust him anymore. And I think that if you were to ask around, this isn't an isolated case. So it's important that we remember that the patient is part of the team and they need to be included in all the decisions except the price. So that's number one. Number two is, there's a common saying I think applies especially to us for the next couple of months, is fake it till you make it. I still remember, like yesterday, although it was last Thursday, the day of my first patient. The night before, you're very nervous. And, I had a friend come over and I was doing like the little physical exam that you're supposed to do to them, palpating all the muscles and finding the lymph nodes and, rubbing all the muscles in their neck. And, he'd be asking me, why are you doing that? And I didn't know. So I was glad to have that chance to look like a fool in front of him, And it gave me a chance to ponder, what am I going to do when, someone else asks me this? And so I came upon something that works for me, and I think will work well for my classmates as well. I fabricated generic reasons applicable to any number of possible situations. And then practice it in front of the mirror. After developing a few generic and well-rehearsed answers, I am now ready to answer any possible question that they could ask me. I'll give you an example. Let's say someone comes in and asks me, why are you palpating all my muscles of mastication? Why are you messing with my jaw and massaging my neck? I'm here to pick up my son. I can't confidently answer them. Well, this is a learning school, so I have to do this to every patient to give me experience, the experience I need to become a competent dentist. You can apply that. So, that was number 1 and 2. Number 3 is I think it's important that we are positive and enthusiastic. I'm not saying you need to go overboard with cheeriness, but patients notice your attitude and feed off it for better or worse. There is a quote in our refrigerator that inspires me to be positive. The quote is by the prophet Gordon B. Hinckley and says, I would like to suggest that we stop seeking out the storms of life and enjoy the sunlight. I'm suggesting that we accentuate the positive, that we more generously compliment virtue and hard effort. There is good all around us if we will only look for it. So these are 3. Communication, fake it till you make it, and being positive and enthusiastic. In conclusion, I know that this is the dawning of a new day in the lives of everyone in the class of 2006. We have all accepted the commitment that comes with the awesome opportunity that lies before us under the mantle of these shiny white coats. May we take that commitment seriously as we move forward with the confidence of the experience, the confidence of the highly skilled, and the enthusiasm of a 6-year-old child. As Shakespeare so eloquently put it, it is not in the stars to hold our destiny, but in ourselves. Thank you.
Thank you, Dave. Now you know why this is the favorite part of my program. I was also taking notes, and the fake it till you make it part was especially useful to me, so I'll